Hello and welcome. If you're watching this, chances are you've sat in a doctor's office, received test results, and walked out feeling more confused than when you arrived. You're not alone in that experience, and today I want to have an honest, straightforward conversation about the health numbers that matter most as we age, what they actually mean, and how to use that information to have better conversations with your healthcare team. I'm speaking to you as someone who's spent years in clinical practice, and I've learned that the biggest gap in healthcare isn't always the medicine itself, it's the communication. Too often we hand people numbers without context, percentages without explanation, and ranges without helping them understand what those ranges actually represent in their daily lives. So, let's change that right now. Let's start with something almost everyone gets tested for: blood pressure. You've probably heard 120/80 mentioned as the ideal. But what does that actually mean for you personally? Blood pressure measures the force of blood against your artery walls, and it's given in two numbers. The top number, systolic pressure, measures that force when your heart beats. The bottom number, diastolic pressure, measures it when your heart rests between beats. As we age, our arteries naturally become less flexible, which is why blood pressure tends to rise. That's a normal part of aging, not necessarily a crisis. What matters more than hitting some perfect number is understanding your trend over time and your individual risk factors. If you're 65 and your blood pressure is consistently around 135/85, that's different from it jumping from 120/75 to 135/85 in 3 months. Context matters. Your doctor should be looking at the whole picture: your activity level, your family history, whether you have diabetes, your kidney function, and yes, your age. The guidelines have evolved because we've learned that treating blood pressure too aggressively in older adults can sometimes cause more problems than it solves, particularly increasing fall risk from dizziness. Now, let's talk about cholesterol, because this is where things get confusing fast. When you get a cholesterol panel, you're actually looking at several different measurements. There's total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides. Most people have heard LDL called bad cholesterol and HDL called good cholesterol, but that's an oversimplification that doesn't serve you well. LDL cholesterol carries fat to your cells, and when there's too much of it, particularly the small, dense particles, it can build up in artery walls. But here's what often doesn't get explained. Not all LDL is equally problematic, and your LDL number alone doesn't tell the whole story. Your HDL cholesterol helps remove excess cholesterol from your bloodstream, which is why higher levels are generally beneficial. Triglycerides are another type of fat in your blood, and elevated levels often indicate insulin resistance or excess alcohol consumption. What really matters is your overall cardiovascular risk, which includes these numbers plus your blood pressure, your family history, whether you smoke, whether you have diabetes, and your age. There are calculation tools your doctor can use that take all these factors into account to estimate your actual risk of having a heart attack or stroke in the next 10 years. That's the number that should drive treatment decisions, not any single test result in isolation. Blood sugar is another area where understanding context makes all the difference. When you get a fasting blood glucose test, you're measuring the amount of sugar in your blood after you haven't eaten for at least 8 hours. A normal fasting blood sugar is generally under 100 milligrams per deciliter. Between 100 and 125 is considered pre-diabetes, and 126 or higher on 2 separate tests indicates diabetes. But there's another test that's become increasingly important, called hemoglobin A1C. This measures your average blood sugar over the past 2 to 3 months by looking at how much sugar has attached to your red blood cells. An A1C below 5.7% is normal. 5.7 to 6.4% indicates prediabetes, and 6.5% or higher indicates diabetes. What makes this test valuable is that it shows the pattern over time, not just a snapshot from one morning. Here's where age and individual circumstances matter tremendously. If you're 45 and have an A1C of 6.8%, that's concerning and warrants aggressive management. If you're 78 with multiple health conditions and an A1C of 7.2%, your doctor might recommend a less aggressive approach, because the risks of driving blood sugar too low, particularly hypoglycemia and confusion, might outweigh the benefits of tight control. These are nuanced decisions that require conversation, not just following a flowchart. Kidney function is tested through something called creatinine and the estimated glomerular filtration rate, or eGFR. Your kidneys filter waste from your blood, and creatinine is one of those waste products. When kidney function declines, creatinine builds up in your blood. The eGFR estimates how much blood your kidneys are filtering per minute, and it's adjusted for your age, sex, and race. Normal kidney function is an eGFR above 90, and as it drops, it indicates progressively worsening kidney function. What's important to understand is that kidney function naturally declines with age. An 80-year-old with an eGFR of 65 is very different from a 50-year-old with the same number. Mild to moderate kidney disease is common in older adults, and doesn't necessarily mean you're heading toward dialysis. It does mean being mindful about medications that stress the kidneys, staying well hydrated, and managing blood pressure and blood sugar if you have those conditions. Your doctor should be tracking the trend, not panicking over a single number. Thyroid function is tested through TSH, which stands for thyroid stimulating hormone. This can seem backwards at first. TSH is produced by your pituitary gland, not your thyroid. When your thyroid isn't producing enough hormone, your pituitary makes more TSH trying to stimulate it. So a high TSH actually indicates an underactive thyroid, or hypothyroidism. A low TSH indicates an overactive thyroid, or hyperthyroidism. Normal TSH is generally between 0.4 and 4.0, though some doctors prefer keeping it between 0.5 and 2.5. Thyroid problems become more common with age, particularly in women. An underactive thyroid can cause fatigue, weight gain, cold sensitivity, and depression, symptoms that are often mistakenly attributed to just getting older. That's why testing makes sense if you're experiencing these symptoms. Treatment is usually straightforward with a daily thyroid hormone pill, but finding the right dose takes time and repeat testing. Vitamin D is tested more frequently now, and deficiency is extremely common, particularly in older adults who spend less time outdoors and whose skin produces less vitamin D in response to sunlight. Normal vitamin D levels are generally considered to be above 30 nanograms per milliliter, though some experts advocate for levels above 40. Low vitamin D is associated with bone loss, muscle weakness, and increased fall risk, all serious concerns as we age. Supplementation is simple and inexpensive, but it's worth knowing that vitamin D is fat-soluble, meaning it should be taken with food that contains some fat for better absorption. Very high doses aren't better and can actually be harmful, so working with your doctor to find the right dose based on your levels makes sense. Bone density is measured through a DEXA scan, which stands for dual energy X-ray absorptiometry. This test measures the density of your bones, usually at the hip and spine, and compares them to the bones of a healthy 30-year-old, giving you a T-score. A T-score above -1 is normal. Between -1 and -2.5 indicates osteopenia, which is reduced bone density, and below -2.5 indicates osteoporosis, which is more severe bone loss that significantly increases fracture risk. Understanding your bone density helps guide decisions about calcium and vitamin D supplementation, weight-bearing exercise, and in some cases, medication to strengthen bones. If you have osteopenia, that doesn't automatically mean you need medication. It means being proactive about the things that protect bone health: adequate calcium and vitamin D, regular weight-bearing exercise, not smoking, and limiting alcohol. Now, let's talk about what to do with all this information. First, ask for copies of your test results. You have every right to them, and having your own records is invaluable, especially if you see multiple doctors or move to a new area. When you receive results, don't just look at whether they are in the normal range. Ask about the trend. Are your numbers stable, improving, or gradually worsening? Trend matters more than any single reading. Second, understand that normal ranges are based on populations, not individuals. A test result that's normal for most people might not be optimal for you, and conversely, something slightly outside the normal range might be perfectly fine given your individual circumstances. This is why the conversation with your doctor matters so much. Third, Be wary of anyone who tries to sell you supplements or treatments based solely on being at the low end of normal or having some minor variation. The supplement industry has become very sophisticated at creating anxiety about subclinical deficiencies that don't actually require treatment. If something is truly deficient and causing symptoms, yes, address it. But optimizing every number to some theoretical ideal isn't supported by evidence and can be expensive and potentially harmful. Fourth, recognize that managing multiple chronic conditions requires balancing competing priorities. The goal isn't perfection in every metric. It's optimizing your overall health, functionality, and quality of life. Sometimes that means accepting slightly higher blood sugar to avoid dangerous lows, or accepting slightly higher blood pressure to avoid dizziness and falls. Finally, use this information to be an active participant in your health care rather than a passive recipient. When your doctor recommends a test or treatment, ask what you're looking for, what the results might change about your treatment plan, and what happens if you don't do it. These are fair questions, and good doctors welcome them because engaged patients generally do better. Your health numbers are tools for understanding your body, not grades on a report card. They are most useful when understood in context, tracked over time, and used to guide conversations about what matters most to you as you age. That might be staying active enough to play with grandchildren, maintaining independence in your own home, managing pain so you can enjoy hobbies, or simply feeling well enough to enjoy each day. Medicine has become very good at measuring things, but measurements alone don't constitute care. Care happens when those measurements inform decisions that align with your values and goals. So, the next time you get test results, I hope you'll feel more equipped to understand what they mean and how to use them in service of your health and well-being. Thank you for watching, and I hope this has been helpful.